Health is a fundamental human right, and access to qualitative health service is a key indicator of development.
The KWARA State government believes that the well-being of our citizenry is fundamental to the socio-economic development of the state. Good health is a necessary precondition for progress, as poor health inevitably impedes socio-economic productivity and human capital development.
The Sustainable Development Goals number 3 is to ensure healthy lives and promote well-being for all at all ages. This includes financial risk protection, access to quality and essential health services, and access to affordable essential medicine and vaccines for all. According to the United Nations Agreement on the SDGs, the universal health care coverage is a goal that should be achieved by member states by the year 2030. Given the understanding of the importance of health, the Governor Ahmed administration has made the health sector an area of focus, starting with access to quality essential health care services for Kwarans, irrespective of their location within the state. In his first term in office as executive governor of the state, Alhaji Ahmed commenced the renovation and upgrading of 5 general hospitals in the state, namely Kayama, Share, Omuaran, Ofa and Ilorin general hospitals, which were completed and opened to the public in 2014. General Hospital, Share, in Ifelodun local government area. According to the residents of the community, the hospital has made it possible for them to access qualitative health care, as the hospital is fully equipped with necessary health facilities and medical personnel. It also serves other communities in the local government and beyond.
Before the innovation, it was a general hospital, but not up to this standard. But the standard was improved, and there were a lot of reconstruction that were done, and it was upgraded to General Hospital Share in 2014 and was commissioned. Since then, the patients' inflow, the number of patients we see in a day, has increased tremendously up to today. Also, there was a program that was a KWARA State Health Insurance Scheme by the IGR Community Insurance Scheme and the Pharmacists Partnership. They were doing a free, or they were doing an insurance medical scheme in KWARA State, which included this hospital. And that increased the number of patients that we see.
I brought my sick father to this hospital. We brought him here after we heard about the quality healthcare facilities available. My old man is feeling better, and we have only come today for checkup.
When Governor Abdulfatai Ahmed came on board in 2011, 2014, he upgraded and even elevated that general hospital in 2014. In fact, it was commissioned in 2014. And it was fully equipped and being staffed. And since then, the community has been enjoying health services. Well, because even from other communities, nearby community, they used to come to this general hospital for treatment. Most of the sicknesses that they used to refer people to maybe general hospital in Ilorin, general hospital X-Way, but now those services are being rendered perfectly in this general hospital because the hospital is equipped even with modern equipment, the hospital is staffed with qualified and experienced staff and officers. So the community is enjoying the services rendered in General Hospital Share.
When we used to come here before, the hospital was not this good. But now, it has been renovated and we are enjoying the facilities here. The nurses also are professionals. We thank the government for the renovation of this hospital. May God be with them.
General Hospital Kayama is located in Kayama Town, headquarters of Kayama local government area in the northern axis of the state. The renovated and upgraded General Hospital has changed the face of healthcare delivery in the local government area, as they can now more readily get urgent medical attention when needed without traveling to the state capital.
Lab departments, a lot of equipments are there which were not there before. Talking about the blood bank, talking about the refertron used in electrolyte urea and creatinine test for genotype, test full blood count machine, the blocks. So they brought quite a number of equipment in the laboratory.
Alhamdulillah, they innovate our general hospital. After innovation, they bring some medicines and other tests. And we also have new doctors there. The trial of his bed.
General hospital here, Kayama, their services is moderate, is fair. I also thank the state government for their effort in improving the facilities of the General Hospital Kayama here.
The story is not any different at Omuaran town and Offa towns in the state, where residents of the town and environs have been able to access quality health care as a result of the commitment of the state governor, Alhaji Abdul Fattah Ahmed.
General Hospital Omuaran happened to be a secondary health facility in the state. And different from that, if you look along this axis, we are talking of Ekiti, Okero, Irepodun, and some part of Ifelodun. This is just like the major hospitals that serve most of those local government. So based on that, you see the importance of putting a functional secondary health facility that will be able to function as a secondary health facility, because it means we should be able to take care of some major complications that have been referred to us from most of the other comprehensive health center or primary health center within their axis, so that it's not every patient that has complaint that we will now be moved directly from this place or from all over this place to the teaching hospital learning. So by so doing or renovating the hospital, it's like reducing the workload on the teaching hospital in Ilorin.
It was colonial because it was built by the colonialists, and you transform it to something modern and beautiful and attractive, and everybody comes in here and says, wow, this hospital is, beautiful. And in addition, you put the tarred roads there, so it makes it beautiful also. We've had more doctors. We had 5 doctors when I got here. Now we have 12 doctors, so we had more doctors. And the real prospect is to make this place a teaching center where we have training for doctors, nurses, pharmacists, lab scientists, and all that. We have experienced doctors, nurses, pharmacists, lab scientists, records officers. We have experienced people on ground, and administrators. We have experienced people on ground, and because of that, we're able to do a lot of things more than you expect us to do.
I'm really trying. At least I came here for antenatal, and the services are okay. I would like to appreciate the government of the day. They really tried compared to what the General Hospital used to be like in some years back. At least the environment is conducive.
They are very, very accommodative and hospitality. They did a very wonderful job. They handled us with care and they accepted us with love and gesture.
I've delivered the baby already. I thank God it was successful and nice. In fact, they are superb, very nice and accommodating. good mother indeed. We really appreciate the governor of the KWARA State, that is Governor Abdul Fattah Ahmed. We really appreciate him for his good work, especially for the government hospitals. We appreciate him. More grace to his elbows.
There is also the 500-bed capacity Ilorin General Hospital, a world-class hospital facility which has been able to provide specialized and general healthcare services to both Kwarans and non-Kwarans alike. The medical facility is designed to serve as a referral center for all the other general hospitals.
We've worked on general hospitals and we've worked on some basic health centers. We want to strengthen the basic clinics within the nooks and corners of the state so that our policy of people not moving beyond 500 meters to access basic health care is truly brought to bear alongside with the health insurance scheme. In our understanding, this will truly improve on people's healthcare service delivery and most importantly, increase productivity.
General Hospital Ilorin is the biggest and the busiest and where the most resources have been allocated in KWARA State, simply because it's an 800-bed hospital saddled with the responsibility of taking all referrals from all other hospitals in KWARA State. And this is where we have the most consultants to accommodate different disease states and to provide adequate services not only to Ilorin and its environment but across the state. So frequently you will see transfers or referrals coming from other hospitals in the state. However, having said that, there are 4 other hospitals that were rehabilitated to provide equity in the distribution of healthcare services. We're not expecting somebody who, for example, lives in Kayama, which is the extreme northern side of KWARA, to have to be moved to to General Hospital Ilorin. But so there's a replica of what we have at General Hospital Ilorin in terms of facilities in Kayama to take on the responsibility of addressing the healthcare needs of people in that environment, in that locality. The same thing we have in Ofa, in Umaro, in Share.
As a listening governor, Alhaji Ahmed approved the expansion of the Ilorin General Hospital services to include a renal center with dialysis machines installed and both the required technical and human resources to cater for the unique needs of patients with various forms of kidney diseases.
Currently we have hemodialysis machines provided by the state government. The machines have been put into use. They were procured a few weeks ago and we have started using them. For now, the machines are very good and they are new and we have no problems at all with them, with the installation and everything. Patients have been treated with them. Patients have had sessions of dialysis and we have no record of serious complication or mortality. We hope to extend our clinics to even include screening clinics, kidney disease clinic, post-transplant clinics, then our care too. We hope to increase on the number of machines we have. We hope that one day we'll start peritoneal dialysis, and ultimately we are aiming at being a center that can do renal transplantation in Nigeria.
First, I'm an origin of this town, but I came all the way from Lagos. In the renal care center, that I'm having problem with my kidney. I'm suffering from kidney problem. So, and I've been on dialysis on 3 occasions. So I'll be going for the 4th one next week now. So, but I'm getting better. The doctors and the nurses are trying.
The upgrading of General Hospital was a major step in enhancing and changing the face of healthcare delivery in the state. However, it was only part of the bigger picture in the healthcare agenda of the Alhaji Ahmed administration.
Since commencement of services, our hospital has continued to grow, not just in terms of patients and clientele, but even in terms of all our activities, services, training, and some level of research activity that has been going on in the hospital.
The state primary healthcare centers and cottage hospitals across the 3 senatorial districts of the state were also key to the delivery of qualitative and affordable health care to KWARAns. The KWARA State Primary Healthcare Development Agency was established to oversee the activities of all 43 state-owned and 400 local government-established primary healthcare centers and dispensaries, with the continual distribution of necessary equipment and drugs to these facilities to ensure access to quality healthcare within a 500-meter radius.
Before now, we know that majority, a larger percentage of people are in the rural areas and at grassroots level, and they are almost inaccessible to whatever provision the government is making generally, and in particular for health. So in order to take health service delivery to as close to people as possible so that they will be able to access health and be able to get their needs met in terms of health. That is why primary health care centers are established. The aim of establishing primary health care itself is to make health service delivery accessible, acceptable, and affordable to people at grassroots level.
KWARA Primary Health Care Department comprises of the curative aspect and the preventive aspect. Curative means the direct care of patients who are already sick, who are already admitted into the hospital. We see to their utmost care until when they regain their health back. While the preventive aspect is where we try as much as possible to see that the masses, the community, or our people rather, are protected against contacting diseases.
Primary healthcare centers in rural areas of the state are continually overhauled and equipped to make them more functional to cater for the needs of rural dwellers. This is done as a continual process, as more centers are due for upgrade in the course of the year. The Community Health Insurance Scheme has continued to play a great part in enabling KWARAns to have a right to a year subsidized basic health care for a premium of just 500 naira per annum.
The health insurance scheme has also been upscaled. Don't forget, it started in the last administration, and when we came in, we had up to about 4,000 people that are benefiting with the health insurance scheme, which enabled people to access primary health care for as good as little as 500 naira in about 1 or 2 local governments. We've since upscaled to cut out across the 3 senatorial districts, and we've also moved people who are benefiting from this to about 600,000. And hopefully before we finish in 2019, we hope to upscale it to up to 1 million. So that in itself has allowed people to access more healthcare services. This has also been supported with the healthcare insurance law, which has brought the whole thing into a legal framework that allows for sustainability and support for our people in terms of healthcare service delivery.
The Community Health Insurance Scheme is a program that was introduced by KWARA State Government. It is introduced in the sense of making sure that you give quality and quantitative health insurance to the people, care to the people within the grassroots, most especially to the vulnerable groups within the community settings. We have our presence in 11 local governments in the state, and then we have an identification card. Immediately you pay your 500, you have a card that shows you that you are active, and that card is going to last you for a year. You're going to be active for a year, and immediately your card is running out, you go back and enroll yourself. Because this is a promise we wanted to give the best to the people, and that is why His Excellency has called for the expansion of the project.
In 2017, the scheme was scaled up to the State Health Insurance Agency with a view to broaden its scope and coverage as the governor signed the State Health Insurance Agency into law.
Establishment of the Health Insurance Agency in KWARA. Of course, we know it's part of our strong commitment to drive healthcare services and, of course, ensure a very functional human capital development program in the state. Because we know that a healthy population is a wealthy population. This insurance scheme is designed to cover all in the state, especially those people who are a bit financially challenged. We expect that they will be able to benefit from the scheme. Of course, this is coming on the heels of our success in the community health insurance scheme. We've seen the success, we've seen the efficacy, and that is what is driving us into coming out with a statewide health insurance scheme that will give the much needed healthcare services in the state.
Placing a high premium on primary health care and routine immunization, Governor Ahmed recently flagged off the measles vaccination campaign in the state. The event, which held at the General Hospital Ilorin, signified the commencement of immunization against measles across the state for children between 9 months and 5 years. The event had the presence of stakeholders in the state health sector, including the chairman, House Committee on Health, Alhaji Ahmad Ibn Mohammed, Permanent Secretary, Ministry of Health, Comrade Olaiton Adefila, State Executive Secretary, Primary Healthcare Development Agency, Dr. Abimbola Folorunsho. There were goodwill messages from the stakeholders in the state.
WHO is pleased to be part of KWARA State Government in its activities to ensure the people of KWARA State attains the highest standard of health. For the past 9 years, 2009, KWARA State has maintained a polio-free KWARA, and this government has sustained that in the last few years too. WHO will continue, and other partners will continue to support KWARA State in their efforts to ensure that the people of the state are alleviated from communicable and non-communicable diseases. We enjoin everybody to please work towards a successful business campaign.
Alhaji Ahmed sees the opportunity to call on parents and caregivers in the state to justify the huge investment the state government has made for the exercise by presenting their children for immunization. He also shed light on the State Primary Healthcare Development Agency and the State Health Insurance Scheme as part of efforts to ensure quality and affordable healthcare services for all Kwarans.
To prevent the outbreak of measles in the state, the KWARA State government has put in place strategies to reduce the burden of measles and place a high premium on primary health care and routine immunization. For instance, we have established the State Primary Health Care Development Agency, which has so far made about several primary health care facilities functional. The agency also provides routine immunization on a regular basis to ensure that citizens of the state, especially children, are protected from vaccine-preventable diseases. Additionally, we have supported primary health care activities by paying the counterpart fund for this measles vaccination campaign and the biannual maternal newborn child health week, which is aimed at delivering high-impact interventions to mothers and children. Let me add here that the forthcoming state healthcare insurance scheme would also ensure that quality and affordable healthcare services, including immunization, are accessible to all citizens of KWARA State, regardless of their economic status. In this regard, we must overcome all social impediments and prejudices standing in the way of full immunization coverage for measles and other vaccine-preventable illnesses. On no account should we deprive our children a secure future and a healthy life on the basis of cultural and religious beliefs. On our part, this administration is committed to ensuring immunization and other primary health care services are available and accessible to all Kwarans.
The leadership of Governor Abdul Fattah Ahmed is living up to its objectives to deliver world-class healthcare system and medical services to the people of KWARA State as well as ensuring good health and well-being of citizens and residents.
I don't know the way I put this, it's 98% try. He try.
KWARA State, it's good here.